Hello guys, we start our course of orthopedic and traumatology. Today is a first lecture. It is small, easily, just listen me and maybe sometimes it will help you. For example, in exam. Yeah. Okay. Organization of trauma help. When we talk about traumatology or orthopedics, for example, in Russia we always use traumatology, word traumatology. In English, the same is orthopedics, for example. Yeah, and when in English we talk about trauma centers, in Russia it is just a hospital with people who can do something when we talk about trauma. In Russia we have word trauma. In English this is a word injury, and sometimes people use word trauma. And in Russia we have word traumatism. In English it is a traumatism too. If we talk about trauma, this is anatomical and functional disorders. When we talk about traumatism, traumatism are a set of injuries when certain groups of the population are affected by certain types of injuries. You need to remember that we have a work injury or industrial trauma. This injury is received at work or on the way to work or on the way from work, payment 100%. Okay, in Russia we have word травма на работе. Sorry, English changed my mind. 1 second. Производственная травма. That means work injury or industrial trauma. What's interesting, this injury is received at work or on the way to work or on the way from work, and payment in 100%. And all paid begin from the first day. What you need to understand, it is very important for doctors to ask patients about trauma. Is it in work or it at home trauma? Because in jurisprudence it is very important. For example, non-work injury trauma. It paid not from first day, it paid from 6th day. Okay, now talk about provision of trauma care. You know that we have first aid, yeah, and in trauma it's 2. Next one is outpatient treatment, ambulance treatment, third type inpatient treatment, hospitalization of patient, and first step it is a rehabilitation. There you see a funny joke picture where words are just in Russia. Orthopedic department may be at 5th floor. First aid skills should be possessed by police, firefighters, military, and vehicle driver. No, and of course doctor, average medical staff, and other people. At the sun, immobilization, anesthesia, stop the bleeding, to carry out hemostasis, not hemostasis but hemostasis. Apply a bandage, basic CPR, cardiopulmonary resection, and transportation. But about bleeding, I think that first of all you need to stop bleeding, and then you need to do immobilization and anesthesia, because people can die if we lost many blood, but people never die if we don't immobilize limb at first step. Next one is outpatient treatment, and it is in fracture clinic. In Russia we have fracture department. This is called Traumpunkt, punct of trauma, punct of injury, and there sit a doctor with nurse, sometimes with some nurse, where they do examination patients after trauma, because every day we have many injuries. They always do X-ray for patients. They always do primary debridement and do bandage, soft and hard, of course. Inpatient treatment. We have any departments. There we talk about traumatology, combined injury, and orthopedics. The next one. The next step of trauma organization, it is a rehabilitation. Always it started in hospital, and we need to do rehabilitation because it is necessary to restore the lost function. And we start to do it in hospital, then we do it in polyclinic, then we can do it in rehabilitation centers and sanatoriums. Okay, that's all, guys. Thank you for your attention. I have one ask for you. Do remember in what is these locations? If you don't remember it, don't worry, because in third topic we will talk about these locations. And in next topic we will talk about examination, and it is very necessary for you to remember about examination. Okay, thank you very much. Be healthy, and don't worry, all will be better than today.